Yeah, yeah. So
Okay.
just let me know, and I will. Some of these exercises are going to be tough, so you be ready to work today. And
Okay.
it's not that they're hard. We're doing a lot of repetitions and a lot of time just
Okay.
to
So
kind
I
of get
won't
you.
do as much.
Yeah, just to get you moving. Just stop when you need to and rest. Okay.
Raul,
Okay.
can I
Thank
use
you.
the span?
Hi, Ellen. Say it again.
Is this going to be okay to use the span? It expands.
Yeah. Does that fit around your thighs? Okay.
Oh, yeah. Yeah.
Okay.
Oh,
All right.
I'll go get a ThoroBand. I've got
Yeah.
one.
Yeah. We'll try it and see how it goes. Okay.
Let me go grab it. Okay.
Yep. I'll wait another minute. I'm pointing. Sure you're doing it right.
Hi, Amanda.
She can't hear you, but she says hi, Allison.
Hi, Allison.
I have the AirPods into my ears only, so she can't hear.
Oh, it's got my husband's name on the thing, so it's
Yeah.
not Lawrence, it's Allison.
Yeah, Lawrence, right? Yep.
Right, Allison.
Yeah, I remember you, Allison. Okay, so we're going to get started here. We got a lot to do. Thank you guys for joining us. Today is the last class of the series here. And in the last class, I like to do a little bit of a just kind of twist to things, make you guys work a little bit harder in a different way than we've been doing. We've been doing like sets and reps, 2 sets of 15, 2 sets of 10. Today we're going to be doing AMRAPs, which is as many reps as possible within a given amount of time. So AMRAP stands for as many reps as possible within a given amount of time. And that just kind of makes you guys work a little bit harder. Again, all of this is to help you get stronger, but if you feel like it's just too much for you, if it's something is hurting, then just back off, rest. With each exercise, pretty much each one, I have a corresponding stretch. So if you have your hand out there, if you get tired and just want to stretch, then go into the stretch that follows that exercise on the handout. Okay? All right, so we're going to start in quadruped. And our lovely assistant, Amanda, will be demonstrating for us. Let me make sure that we get her in good view. And then again, like we always do in quadruped, we line up hips over knees, shoulders over wrists. Her back starts in a really straight position, and she's going to go into a few just cat, cow, cat, camels, rotate her spine, again, creating mobility and using her muscles in her hips and her abdomen to create a movement. So arch your back into the cat, into the camel, and then round your back into the cat, the angry cat, okay? I'll take a quick look to make sure you guys are okay. Again, this is just a nice little warm up that we like to do when we start in a quadruped position. And again, using your abdominals, and the only thing that should be moving is your pelvis and your spine. Your arms, your hips should pretty much stay stationary. Very nice, Allison. Good. Helen, that looks really good. Do a couple more, and then we'll get started with our strengthening exercise. And for the first one, you guys at home, keep going. I'm going to have, actually, why don't you guys take a break there for a second and then put on your TheraBand above your knee. The first one's going to be a quadruped fire hydrant. Okay, this one is working both the core and the hips at the same time. Okay, so we line ourselves back up into quadruped, and I'll wait just a few minutes and I'll talk about this exercise while you guys are getting your TheraBand on. The point of this exercise is to strengthen the lateral or the side gluteals right here where I'm pointing on Amanda, while you're stabilizing and strengthening your core at the same time. So again, we establish that neutral position right in the middle, which is the extreme of the cat, the middle ground of the extremes of the cat and the cow exercise that we just did. So finding that middle ground so that you're really pulled in through your abdomen. Once you've found that neutral middle ground position, you're pulling in through your abdominals like we've learned, and she's gonna unweight her left leg and she's gonna kick it out like a fire hydrant. So think about what a dog does to a fire hydrant. That's where this exercise name comes from. And she's not gonna rest it down, she's gonna keep it up the whole time. So it's almost as if she's plugging in her thigh bone into the hip socket to lift it off the table, creating clearance to allow her to move the leg to the side into that fire hydrant position. And you can kind of see here, she's doing a nice job of stabilizing here. And if you ask Amanda where she's feeling it, She's going to tell you she's feeling it on the side glute and in the abdominals to keep her pelvis and her back stable. She's probably also feeling it on the opposite leg or on the opposite hip, because that leg is really working as the left leg is going up into a fire hydrant position. She's going to do 15 total. Not sure what number she's on, but I'm going to give her credit for 2. I'm joking. She's got about 5 more to go at this point. So guys, keep going. Again, you're kicking your leg out straight to the side as far up as you can go without allowing your pelvis and your spine to move. Okay. There you go. Good. That's 1 on that side. Now she's going to go back to the other side. She's going to reestablish position of neutral. Again, pulling in her abdomen. And then she wants to go, just a quick reset, Amanda, go ahead and go into your cat and camel. Good. There's a cat. There's a camel. And then that middle ground right there, hold it. That's your middle ground. That's neutral. Maintain your abdominals nice and tight and go ahead and start with the right leg. Good. And I know you guys started a little bit late, Allison. But try to do one side at a time, Allison, so that you have a little bit more control. So let's just do the right side right now. So your fire hydrant opening up into the screen. There you go. So just do one side at a, so unilateral, Allison. Okay, once you've done 15, you're gonna rest for just a couple seconds and then you're gonna do another set to stay in line with the handout. 2 sets of 15 based on the handout. This particular exercise, you know, it's a little bit tough, so you wanna make sure this one's not done every day. This is 3 to 4 times a week, try to give yourself a day in between. So she's gonna start again on her second set. And again, remember to plug in that thigh bone into the socket to create an unweighting movement of the knee so it can clear when you're moving up into your fire hydrant position. And she's really opening up to the side, keeping her trunk steady. Good, Ellen, that looks good. Now just reestablish your neutral position, Ellen, before you start again. So remember, it's the middle ground of both extremes of the cat and the camel exercise you learned. In that middle ground is where you maintain yourself. It's going to give you a straight back.
Can you see me?
Yep, I can see you. Looks pretty good there. Now go ahead and start. Now maintain that there as much as possible in that position the whole time so that you, as you open up that hip in the fire hydrant position or movement, the core is really working hard to keep your spine and your pelvis stable. That looks better, Allison. A little too rounded through your spine, Allison, so I would flatten yourself out right there. Now maintain that there as you're moving that leg out. Good. Now try to keep the pelvis completely still so there's no movement at all. You will feel more isolation in that hip and that side lateral glute area. And you might find that one side is weaker than the other, and that happens a lot. So just kind of work through that. Okay, so Amanda is going to go and just rest for just a second, and when we move into our next position. So our next exercise, you guys, if you're not done, finish out your last few reps. Is called quadruped with a mini mountain climber. Yeah, take your bands off. You don't need bands for this next one. If you have wrist problems, if you have a lot of sensitivity through your hands, please be careful with this exercise. This does put a lot of pressure through your wrists and hands, so just be aware of that. And again, Amanda is going to reestablish neutral position of her spine. Okay, she's going to go into her cat camel again, and again finding that neutral position. And I keep going back to that because that's what you're going to get more out of the exercise if you reestablish and maintain that neutral position. Okay, so she finds the middle ground right here, hold, and she's going to hover or lift both of her, curl your toes underneath you like Amanda did, lift both knees off the ground, hold. Now she's going to drive her right knee toward her elbow and then back to center. Left and back to center. We're timing Amanda. She's going to go for about 30 seconds and see how many she can do. And she's driving. And she's driving. Good. So try to keep both knees off the ground, Ellen, the whole time. And then you're just driving. Yep. So again, this is heavy on the wrist. Okay. A little heavy on the wrist. So just be cautious with this one. And that's about 30 seconds, and take a break, Amanda. So I didn't count how many reps she did, but in an AMRAP, again, as many reps as possible, we count how many reps she does, and she writes that down. She did 16 reps within a 30-second period. She writes that down. And the next time we do an AMRAP, we hope that she can do maybe 18 to 20 within that same 30-second period. And that's how we know she's getting stronger. And continuous reps, as many reps as possible until fatigue, obviously maintaining her form, really, really important. And that's how we know she's gaining strength, and we will see the strength gain, not only by her form, but her ability to do more reps. Let's set this up. I'm gonna watch you guys do it. I'm gonna give Amanda a little bit more of a break. So go ahead and set up, get your neutral position. Yep, same thing. Amanda's gonna start. I have your timer going, Amanda. And unweight both knees, Ellen. Good.
Like that?
A little bit less, Ellen. Drop your knees, bend your knees a little bit more. Right there. Now from there, go. Kick it toward that same side elbow and switch, alternating. So pretend you're a mountain. This is called a mountain climber. Good. And right back to where it started. You don't need to kick that leg back any further. Good. Good. Not bad, Allison. Allison, your hips were a little bit too high, but I'll take it. So this is a little bit of a cardiovascular workout as well as a strength exercise for your core. And you're alternating legs. Better, but you don't have to kick the leg back. Once you drive it toward the elbow, then just bring it right back down. Good. Okay. You don't need to kick it out, Ellen.
Okay, I'm going to have to look at Amanda. I'm not doing it right.
Yep, so let me show you Amanda. Go ahead, Amanda. So she's going to unweight her knees. Good. She holds that position neutral. Now she's going to start to drive her knee toward her elbow, same side elbow. And notice she just drives it toward the elbow and brings it back and sets the foot down.
Oh, okay.
And you can go slow or you can go faster like Amanda's doing. Okay, she's driving, puts it back down, and she continues on.
You mean like this?
Yeah, black pants are probably not a good thing.
Yeah. Like this? Well.
Exactly, exactly. Now, the key here is to maintain that spine in that neutral position that we found. And just be careful with the wrist. Good. So you can see if you're doing this for a whole minute, you're really working cardiovascularly as well as strength-wise. All right, Allison, take a break. You did quite a few. And then, all right, so let's turn on to our back, and we're going to do a piriformis stretch. Again, we keep going back to the piriformis stretch because it's classically a muscle that is very tight. Amanda's going to cross her leg, her right ankle over her left knee, and then she's going to pull her left thigh toward her, stretching that right piriformis, right gluteal area. And again, you're holding this one between 30 and 60 seconds to get a nice lengthening effect on the muscle fibers of that muscle in that gluteal area. Okay, go ahead and switch sides. Just kind of recovering, allowing your body to rest and recover, because the next exercise is also hard. Very good. You guys both have good length on those gluteal piriformis muscles. Okay, so grab your TheraBands. We're going to put that back on, and we're going to be in our sideline position. When I design these exercises, I try to, do an exercise in a prone or quadruped position, one on your side, and then one on your back, so that you're kind of targeting all the muscles of the core. Because remember, the core muscles are like an apron. They start from the front of your stomach to the side, all the way to the back muscles. Okay. Okay, so if you're more advanced, you're gonna be in a side plank position, and you're gonna unweight the hips off the ground like Amanda is doing now. Okay, and this is gonna be another hydrant. Okay, we did a hydrant in quadruped. Now she's gonna do a hydrant in a side plank position. Okay, so she's maintaining a neutral position through her spine. She's pulling her abdomen in, and her pelvis is not moving. The only thing that's happening is her hip is opening, and the knee and the foot are going along with it in a straight line. Good, and she's gonna do between, let's see what we have here. She can stop at 15, but you can stop anytime you feel you're ready. That looks pretty good, Allison. Remember, you don't have to come off your hip if you cannot. Sometimes it's too much pressure on the shoulder.
Right, that's why I didn't.
Yep, now the only thing you want, what I would modify with you is to create a little lift through your rib cage. Your hips are gonna stay down, but just create a little lift through your rib cage that's on in this case, your left rib cage. So you're creating activity through that side core, okay? All right, why don't you flip to the other side and I'll be able to see it a little bit better when you guys are ready. Allison, if you can face the other way, I'd be able to see your back a little bit better.
Oh, okay, great.
That way I can give you some cues. Perfect. There you go. Ellen, go ahead and start yours. Good, hold it. Stabilize yourself, good. That looks nice. Now, Allison, as if somebody was pulling the top of the left side of your shirt up toward the ceiling, lift that side trunk. Lift that side trunk by using your abdominals. There you go, good. Now hold that there as you continue to do your hydrant. You will get a lot more out of the exercise if that pelvis is stabilized via those muscles on your side, lifting that rib cage that I was just mentioning. Good. That looks really good. Now soon, if you do enough of these, you'll get enough stability and strength of those side core and hip muscles that you may be able to eventually lift off those hips off the ground and stabilize yourself with your forearm. But again, no rush on that. Okay?
Yeah, no, I feel it too much in my neck.
Do you? Oh, you mean what you're doing now, or if you lift off the hip?
No, if I tried to lift up, I would feel it too much in my neck.
That's perfect. Okay, so you will see that if you continue these, you'll develop enough stability through your trunk and your core that now your neck will not have to compensate and get strained. But that, that takes some time. Sometimes it takes months. I literally had patients working on them for years, and eventually they will develop strength. And one of the things about strengthening also is you always want to vary your exercise. You don't want to keep doing the same exercise, the same reps, the same resistance, the same way, because eventually your muscles don't respond to strengthening anymore. Muscles work on variation, called the overload principle. You got to keep continuing to challenge them in order to continue to see changes. Okay, so that's why I've given you a plethora of exercises. I'm always changing the reps. I'm always changing the rest times so that you can get more out of it and muscles continue to get stronger and change, which is what we want. Okay. Okay, Amanda is finished. You doing okay? Yeah. Okay, did you do 2 sets of 15? Oh, no. So let's do one more set of 15 as a group. And yep. So Allison,
how's that, Raul? I'm trying to hold it up.
Yep. And if I'm going to kind of cue Amanda from the back, that analogy that I gave as if I'm pulling her side trunk, her t-shirt up, that creates that lift through that side. Okay, let me take a look at where you are. Good. That's good. Ellen, these are getting better for you. You look a lot more stable here. And your fire hydrant looks really nice. Your knee and your foot are moving together. That looks good.
Yeah.
So get to 15 and then switch sides. Amanda is our superstar here. Her form is a lot better than when we first started. Another way to advance this particular exercise is to make the TheraBand resistance harder. So right now, Amanda is using a red TheraBand. The next one up we would advance her to would be a green one, and that in itself can make a difference. Okay, so Amanda's done with her 15, and she's gonna get into a spinal rotation stretch for her back and hips. So you guys are done with your TheraBand. So once you finish your last rep, Go ahead and take the TheraBand off. You can do one of two stretches. You can do what Amanda's doing right now, which is a knee to chest on both sides, just to give your back a little bit of a break. Or you can do a spinal rotation where, Amanda, I'm gonna have you scoot yourself to your left, all the way to the left. Good. Cross your left ankle over your right knee, and with your right hand, pull the outside of your left knee toward me, okay? So with your right hand, pull, there you go. Now rotate over as far as you can. The reason I pushed Amanda over to that side is she wouldn't fall off, so she wouldn't fall off the table. And right now, Amanda's feeling a nice stretch through her left glute into her left lower back. Very nice. And you're holding it here for about 30 seconds. Good. Again, creating that mobility concept that we talked about from the beginning of the first class of the first series. You want your hips to be flexible. You also want your trunk to be really strong. Okay. So this is working on the hips, the hip flexibility. Good. Same thing going the other way, guys. This time cross your, let's see. Good. Right knee over your left ankle and then rotate yourself to the left. And you can use your hand, left hand in this case, to pull that right leg over a little further to get more rotation, more stretch through that trunk and the hip area. And again, hold for 30 seconds. Okay, you guys keep holding the stretch. The next exercise, I'm actually using a little bit of a prop, which is called the Bosu. You may not have a Bosu at home. I'm just giving you another option. If for those of you who can do a full plank, which I will demonstrate here in a second, you guys would just do a full plank off on your floor or mat, whatever you guys are laying on right now. So Amanda's gonna stand up here and I'm gonna take her place. I'm gonna try to talk you through it as I go. I'm gonna demonstrate first a full plank, and then I'm gonna do it on the Bosu, okay? So here, off your knees, shoulders are right under, on top of your wrists, and you're holding plank by pulling in your core. Okay, straight as an arrow through my upper back, down to my feet. Okay, and you're holding. Okay, Amanda started the timer already, so she's holding. I don't remember what I put on the handout as far as hold times.
1 minute.
1 minute. Okay. You may not be able to hold a minute. Do what you can.
You got 30 seconds left.
Again, watch for your wrists. Okay. Listen to what's happening with your wrists. That may be the biggest limiting factor for a lot of you.
Ellen looks good. Allison needs to put the volume down.
Okay. Allison, go ahead and drop your bottom a little bit and see if you can get more into a full straight as an arrow plank. And again, just watch out for the wrists.
And then
Ooh, I did 30 seconds.
Awesome. Take a break and then into your child pose while I get the Bosu to demonstrate the variation here to make it a little harder. Okay. This is fine.
All right.
So as you're sitting there, before we start our next rep, just kind of interlace your fingers and then just kind of make circular patterns through your wrists, and just to give yourself a little blood flow and get those wrists a little bit more flexible. They do stiffen up when you're putting that much pressure on them. And Ellen, were you able to do 1 full minute?
Yeah, I got up to 2 minutes yesterday.
Awesome.
Oh my gosh.
Okay, so the next exercise that I'm going to do, Ellen, is going to challenge you, because you're going to be transitioning between a forearm plank, which we've done, into a full plank, and back and forth, AMRAP, which again, as many reps as possible. Okay, let's finish off this last set when you guys are ready. And again, using a Bosu is giving me a more unstable surface, which is going to challenge my core and my muscles a little bit more than just doing it on the flat ground. Again, if you don't have a Bosu, you guys just can do it. And the timer has started. And we're going. And right now, there's not much of a wobble. But if you get on here initially and you're not strong enough, you're going to see a lot of shaking. Okay. Right now, I'm able to stabilize. And that stability comes from a lot of the core and strength in my glutes and in my abdominals to keep, again, this is a half ball called the Bosu. It's filled with air. And it just, again, provides a nice tool for us to challenge our patients to now do their exercise from instead of a flat surface onto an unstable surface. So Ellen, this might be a good tool for you to purchase. You can get them on Amazon. It's called the Bosu, B-O-S-U.
Yeah.
Yep. They're hard to find right now, actually. A lot of exercise equipment that you use at home because of this quarantine are really hard to find right now. Everybody's exercising from home, so all the supplies are taken.
Right.
And that's a minute, and we're going to take a break and then go down into your child pose again. Okay? But Alan, if you ever need, we can always obviously get you back into the clinic and get you an upgrade or a kind of a refresher with one of your therapists.
Right. Thank you.
Okay, I'm going to demonstrate the next one. So right now you guys are just in child pose, resting. And I'm going to join you. We're almost there, guys. We have another about 5 minutes, which is perfect. Perfect timing for this next one. So if you guys remember from our last series, or even from this series, we've done forearm planks, right? So you're here in this forearm plank position, okay? And then we just did a full plank. So what this exercise calls for is a transition between a full plank and a forearm plank. And you go one hand up at a time. So you start in a full plank position, then you put one forearm down, then the other, and then right back up into a full plank, okay? And you keep going as many as you can. So Amanda's gonna start the timer here in a second, and we're gonna see how many we can do. Let's go 45 seconds on this one, Amanda, not a full minute, because we're gonna get tired pretty quickly here. Again, if you have shoulder problems, neck problems, it starts to hurt, please don't push through this. Do what you can. If you wanna stay on your knees, I'll show a variation. We got a full plank on our knees, full plank on my forearms. And push up, full plank on my knees, off my knees, on my knees, I should say, and forearm plank on my knees. Okay, I'm going to demonstrate the full plank off my knees for the purposes of the handout, okay? And go. So then full plank to forearm plank to full plank. And you can alternate which arm you go down with first, okay? So that's two transitions. That's 3 transitions. That's 4 transitions. That's 5 transitions. So drop your bottoms a little bit more, guys. Your bottoms are too high. We've got about 15 seconds to go. And I'm still transitioning. As you can see, it's a lot of work for my shoulders, a lot of work for my scapula and my core to maintain my position and my form. And take a break, drop your knees into child pose, well deserved. That was a hard one. So Ellen, that should have challenged you a little bit more of transitioning from one position. Yeah. And again, I'm breathing, right? So it works a little bit of cardiovascular, gets you really working. Your butts are both a little bit high for both of you guys, but you guys work on that, especially on the transitions, which is the hard part. So the transitions make it a little more dynamic, obviously challenges your muscles a little bit more. So it's just a harder exercise than just holding a static plank. I'm going to give you another 30 seconds rest, and then we'll get right back into our last set for today. Yeah. What do you want to do it? Try it. So I'm going to have Amanda try it so she can feel what it feels like, and I'm going to cue and see what you guys are doing here so I can give you more feedback. Okay, you guys start getting into position into a full plank, whether it's on your knees or off your knees. Start up, yeah. Start in a full plank, in a full plank, meaning your elbows are straight. Okay, and timer has started.
Well, wait, are we doing the transition one?
You're doing transitions, Ellen.
Oh.
You're going from plank, full plank to a forearm plank. Good. That's a little bit high, Ellen, but if that's all you can do, I will take it. Now, if you can work on not swaying your hips from side to side, that's probably another good goal for you. Eliminate the side to side movement and just keep your back, your butt, from being so high.
Okay.
You have another about 10 seconds to go. Okay, 5 seconds to go now.
Is
5,
this correct?
4, say it again.
Is this correct?
Who's talking, Ellen or Allison?
Allison.
Yeah, it looks good. I can't see your bottom half, but it looks like your bottom is a little too high, Allison. But
Okay.
otherwise, it looks pretty good. And take a break. Now, were you on your knees, Allison, or were you off your knees?
Yes. Yeah, I
On
have
your
to
knees?
be.
Okay, no
Yeah.
problem. I would still, no wonder your butt looked a little bit high because you were on your knees. But
Yeah.
otherwise, you look pretty good. You look stable, and you should feel a lot of work happening through your core and a lot of work happening through your shoulders when you're doing that one.
Yeah,
Okay.
and cardiovascular.
Perfect. And that's what we're working toward. Again, it's getting harder. Again, this is more of an intermediate to advanced class today. I'm not going to offer an purely advanced class yet until I have people that can, get challenged at that level. We're going to keep this series going again another 4 weeks. You may see a silly video of me doing some exercises being sent out soon, just to advertise the class a little bit more. But we will continue it. I think at the same time, Mondays at 4:30, I should say. And
Will it be
we
the
hope-
same exercise?
I'm always going to vary it. Remember, I'm going to give you a kind of a good library of exercises that you
Okay.
can draw from to give you a
Okay.
lot of, changing positions. Even just throwing a little variation makes the exercise different. And that in itself gives you that variability that your muscles need to continue to get stronger.
Okay, so I'll probably do yours and Christina's depending on my schedule.
That's
Because
fine.
I was able to modify today.
Great. Yeah, and I'll give you plenty of modifications that you're able to do, because I think Christina's the beginner class might be getting too easy based on what I saw from you today.
Okay, but you know what? It's good for me anyway.
Good. We always say the more movement, the better.
Right.
That way.
And I'm doing Mari's neck class, which has been great. And I'm
Awesome.
doing Alexis's Pilates. So,
Oh my God, you're really getting.
And
You're really
then-
getting.
but then I do 3 other movement classes during the week. So I'm really moving.
I'm all for it. If you can do something every day, I always tell people do something every day is kind of what we're looking
Yeah.
for.
Quarantine has been great for my body.
Good for you. Good for you. All right,
Thank
guys. I look forward to seeing both of you guys at our next class next week.
Thank you so much.
You're welcome, guys. I'll see you guys
Thanks
soon.
so much.